Your liver is your body's filter, and here's what a healthy, clean filter looks like. But what happens when your filter gets damaged, and what can we do to keep it clean? Good morning. It is Monday, April 10th. I'm Jessica Lovell, and welcome to the Morning Medical Update. We know that heavy drinking can lead to liver damage, but where do we draw the line between heavy and normal drinking? Is there even such a thing? Why is liver disease killing more and more young people? That's another question we'll ask. And what else besides the liver does alcohol damage? We are happy to be joined this morning by Dr. Steve Wyman right here in the center. How are you?
I'm very well, thank you.
He is a gastroenterologist and the director of the Liver Center here at the University of Kansas Health System. We also have with us Dr. Rupa Sethi. She is an addiction psychologist and runs the opioid treatment program here at the health system as well. How are you?
Good, how are you?
Thank you both for being with here on this Monday, this very important topic. We'll have lots of questions coming up. Dr. Wyman, though, I want to start with you. We connect alcohol very easily with the liver, but alcohol can damage more than just the liver, correct?
Oh, yes.
Oh, yes.
Alcohol, unfortunately, can have a very negative effect on a lot of things. Obviously, to everyone, the most obvious thing that alcohol affects is the brain, and that's the thing that drives people to drink it. It immediately causes a change in the way the brain functions and cognition, and it has effects, of course, on the liver, but it has effects on the digestive system, as anyone who's ever had a hangover knows. It can cause certain kinds of cancers. It can cause diseases of the pancreas. It can interfere with the immune system. It can lead to frequent even life-threatening pneumonias in many patients. So heavy alcohol drinking takes its toll.
Across the board. Mm-hmm. Dr. Sethi, so when does alcohol start doing the damage? When does the effect start to kick in? And is there such thing as a healthy amount?
Probably immediately, but American Medical Association, National Institute of Alcohol Abuse and Alcoholism defines what is called at-risk drinking. Mm-hmm. Basically, they're trying to say anything above this, you are putting yourself at risk of medical complications or medical problems and psychiatric problems related to alcohol use. For a man, for instance, who's less than 65 years of age, that is no more than 4 drinks a day and no more than 14 drinks a week. For a woman and anybody above 65 years of age, no more than 3 drinks a day and no more than 7 drinks a week. So that means if somebody is drinking 3 glasses of wine on a Monday, a Tuesday, you're literally almost at their cutoff for the week. And this just defines that anything above it could potentially lead you to start having complications or medical and psychological problems related to alcohol use.
But as far as this conversation and the two of you sitting here, is 0 where you want people to be? 0 alcohol use?
I can comment on that. Yes, in a sense, if 0 alcohol use gives one the lowest risk of any of these complications, and although it was once thought that something like 1 drink a day was healthier than not drinking, I think there's now a very strong consensus that that was an error and it's not true. But the risk is not equal as you go on in drinking, and so somebody who drinks, a few drinks a week, it may be conceivable that they're at slightly higher risk than someone who doesn't drink. But all of life has risks associated to it. But there's a really kind of sharp increase at risk when we get up to the levels that Dr. Sethi was talking about, which is 2 drinks a day for women, or maybe 3 or 4 drinks a day for men. And once you get to those thresholds, the risks accelerate rapidly. So while I don't think it's accurate to say there's no risk of even low drinking, it's relatively small. But once you get above those thresholds, the risk can really multiply.
So it's making a little bit of room for reality, because there's reality, Dr. Sethi, and then there's what you would like to see in all patients and perhaps most of the population. Anything to add to that, your thoughts?
Also, alcoholism follows a biopsychosocial model, which means if you're biologically predisposed to, if you have a genetic composition where other family members were hurt by alcohol use, had medical complications of alcohol use, you potentially might have higher risk. So somebody drinking same amount of drink versus another friend might not develop the complications. It all depends on how you and your genetic composition is, but also what your social and your whole psychological mindset is. And that's where depression and anxiety related to alcohol use can come in.
Yeah, and then those problems start to compound. Dr. Weinman, what kind of cancers can this cause?
Well, alcohol can cause a number of cancers. Most notoriously, it causes cancers of the head and neck, the mouth, the tonsils, the oral cavity, but it also causes pancreatic cancer. It accelerates the risk for breast cancer, for colon cancer, and for liver cancer as well. So, and actually this can be reproduced in laboratory animals. If you put them on alcohol, it accelerates cancers. So, you know, you have to think that alcohol actually has a very fundamental effect on the way cells reproduce and function. And just the way it can have major effects on the brain, it can alter the patterns of gene expression in cells, and it can cause cancers by that.
Well, I was going to ask you to give us a little biology lesson, and I did not do very good in biology, Dr. Weinman, so please explain it in ways that we can understand, because this isn't just the immediate effect once it gets into your bloodstream. It goes deep into the molecular level.
Right.
Explain.
And I don't think people necessarily understand that, but you know, all the cells in the body have the same genes, but they act very, very differently, because most genes in most cells are turned off, and they only get turned on when they need to be. And the mechanisms that regulate how genes get turned on and turned off are very complex, and they have to do with proteins that are bound to the DNA and how they change, and alcohol alters those reactions, and it alters them actually in sex-dependent ways, as it's well known. I mean, I think even just as Dr. Sethi mentioned, women are more sensitive to the effects of alcohol than men are, and those phenomena you know, are true in animals, and they have to do with the differences between estrogen signaling and testosterone signaling, and the effects on gene regulation are more pronounced in females than in males, and so it is a problem.
Yeah, it goes deep, deep, deep. Okay, so Dr. Sethi, people know the term alcoholism, but medically it's referred to as alcohol use disorder. And also, you do not prefer the term addict. You prefer somebody who has an addiction to alcohol. Why the change in terms, and why do terms matter when it comes to this, as we've evolved through learning more about the use of drugs and alcohol?
I think addict has been a word that has been used for a long time, and it has negative impact on people who get that word to them. And so we have evolved as addiction as a disease, just like diabetes is a disease. So we call it the addiction disease, and we call somebody suffering from addiction. Now, there's a very fine line between somebody drinking alcohol regularly, drinking more than what should be, and then developing an alcohol addiction, which we call it as alcohol use disorder. And not to go over all of those criteria, but in general, if you are drinking more and more to get the same effect that you were getting already, which is called tolerance, or when you stop drinking, you start having withdrawal symptoms. For instance, people can start having tremors, feel very anxious. Some people might develop seizures when they stop drinking. That's called alcohol withdrawal. And of course, this is all linked with the core problem of addiction, which is you continue to drink despite knowing that you're having physical or mental consequences from drinking.
So are there different levels of AUD, alcohol use disorder? Is it either, nope, you're full blown and everything else could be considered some form of moderate, or is it you either in or you are out? It's either affecting you negatively, your work, your family, your friends, your relationships, your health, or not. So where do you fall?
So we divide them into mild, moderate, and severe use disorder criteria, and we have a set of 11 criteria that we look at. There are also internal criteria and external criteria. Internal more being you're sitting with family, but all you're thinking is, oh, I need to go get my glass of wine, or I need to go get my beer. You are, trying to cut down, but unsuccessful to cut down, and you're using more and spending more and more time maybe trying to get the alcohol, use the alcohol, recover from the effects of the alcohol. And all these internal preoccupations lead people to have external consequences. For instance, they might not be reporting to work. They might not be picking up their kids from school. So that all leads to social interpersonal problems between husband and wife at work. And then they're trying to overcompensate because they want to perform and they want to say, no, I can do this. And maybe driving, so physically hazardous stuff like driving when you're drunk and leading to consequences of those. We pick out two criteria. If you have two or more criteria out of all that I've said, you can actually qualify for having an alcohol addiction. And that's a mild. And if you go up and you meet more and more criteria, you could have severe alcohol use disorder.
So that's how AUD changes the body, mind all the way down. Talk to me a little bit more about that, because you mentioned it earlier. Just specifics of how it's changing you.
So, when we talk about alcohol use disorder, we talk about alcohol, and when there's a normal neurotransmitter mechanism in our body, there are two of those. They're called GABA and glutamate, and they are normally in sync with each other. We call it popularly the seesaw mechanism. And when somebody drinks, that GABA increases in the body. So GABA is a feel good. Think of it like you're feeling sleepy, you're not anxious, you feel really good about it, you're not doing your things right. And then when people stop drinking, the GABA goes down, and glutamate, which was like your cup of coffee, now shoots up. So you are having all that anxiety, you are having racing heartbeat, you are having withdrawal seizures, you could have alcohol-induced psychotic disorder, and rarely what we really fear with alcohol withdrawal is the delirium tremens, which needs hospitalization at that point.
So what options are there outside of counseling? How do you treat AUD?
So in our addiction treatment center here, we have a couple of medications that we use, which are FDA approved for alcohol use disorder. The really old one is the disulfiram, and that was the one when you drink on top of it, even use a hand sanitizer with it, you could become very sick. So we've shied away from that one, but we still use it in certain people, maybe a healthcare provider, maybe somebody who really does not want to drink, we use that medication. Then there's the most liked one, which we use a lot. It's called naltrexone. It's actually an opioid antagonist, which means it sits on the opioid receptor and blocks it, but it releases dopamine. It prevents the release of dopamine from the body, and so it takes away that feeling, the feel-good feeling when you drink. So people can still drink on top of it, but they won't feel as good. And most of our patients come and tell us, I drink, but you know what, it didn't feel as good, so I just had one or two drinks and I stopped. So it's a very good harm reduction strategy that we use in our clinic.
And in layman's terms, they're not getting the buzz.
Yes, they're not getting the buzz.
Okay.
And that is one that comes in once a month injection, popularly called Vivitrol. So the good part is when you're taking an oral medication, if you want to go drink, you will stop the medication and go drink, right? In this case, you're getting a once a month injection. You go to the clinic, you get your injection. Even if you end up drinking on top of it, you will probably get up next day and say, oh my God, I didn't want to do this. Why am I doing this?
So you didn't get the buzz, but you get the hangover if you were to drink.
You would, yeah.
So you're trying to drink, but you'd realize, well, I'm not getting the buzz, so there's no point in doing it.
And the next day, most of the people will get up and be like, okay, I need to get back. I need to get back wherever this was. This was not helpful. And then over time, we have seen that people, they're cut down in their amount of drinking, which is our whole harm reduction strategy.
Because it's not giving them what they want. And that makes sense, because you're right. That's why people drink. They want to relax. They want it to kick into the mind. Dr. Weinman, you recommended a really great resource for treatment, the Alcohol Treatment Navigator from the National Institute on Alcohol Abuse and Alcoholism. When we're looking at the website now, we're going to leave a URL on the screen so folks can check that out if they need it. It lets you search for quality evidence-based alcohol treatment. So what is quality alcohol treatment?
Well, I think this navigator from the National Institute for Alcohol Abuse and Alcoholism is a way to try to connect people with local resources, because sometimes it can be very difficult for people suffering from alcohol use disorder to really find the right kind of treatment. When I say when it's talked about evidence-based treatment, it's precisely the kinds of things that Dr. Sethi's been talking about. So there are 3 medications, as she mentioned, that are FDA approved to help people deal with alcohol craving and alcohol abuse. There are certain kinds of counseling and psychotherapy that have been shown to be more effective, and even some very, very simple interventions like taking a quick alcohol inventory and talking to people about some of those things at ordinary doctor's offices can help people. So there are, we're not where we would like to be. We'd love to have a simple way to relieve people of their cravings and their addiction, and I don't think we do. But there's a lot of help. A lot of people have stopped drinking. A lot of people have been able to improve their health dramatically and avoid of the real catastrophes that can happen to people and their families from alcohol use disorder.
Why are some people able to stop cold turkey while others need to seek deeper treatment, you think?
And I think every person is psychologically different, and the way they think and the way they can act on things is different. That's where Dr. Weinman mentioned the role of therapy comes in, because it can actually help you change the way you think. A lot of drinking or alcohol addiction could be just related to your behaviors, and it's a behavior change which can happen if you get some therapy. And therapy is very effective along with medications in treating alcohol use disorder.
So last year, a study looked at overall deaths in the U.S. to alcohol-associated liver disease. We want to show a graph of that study showing a gradual increase and then a big jump when the pandemic started. Dr. Sethi, not surprised?
Not surprised at all. In fact, when the pandemic happened, our clinic was mostly opioid-based, and we saw increasing numbers of people with alcohol addiction coming to our clinic. And we actually have a pretty robust Vivitrol injection clinic right now, and our therapists are doing a lot of counseling for alcohol. So yes, we have seen an increase even in the numbers that came to our clinic.
And there's other CDC data showing that alcoholic liver disease is killing more and more young adults. Dr. Weinman, why are we seeing that?
This is really true, and we have been seeing this. This has been going on probably for about the past 8 to 10 years, that the average age of people suffering from alcohol-related liver disease has been falling. A lot of it has to do with the culture among young people in terms of what sort of like college-age party culture is like. It is much more alcohol intense than it was a generation ago, and
people starting earlier.
Yes, and there's all kinds of. I mean, people will, preload before they go to parties. They will, the goal is to get drunk as fast as you can and to, achieve a state where you don't remember what happened the night before. And people start on Thursday nights and go through Sunday, and this intense weekly binge drinking, even if you don't drink the other 4 days of the week, is particularly for the liver. That kind of on and off injury healing can rapidly accelerate liver disease. And we are seeing severe alcoholic liver disease in people in their 30s, which didn't used to happen before. And then the pandemic just made everything worse.
So I want to ask Dr. Weinman, if you need a liver transplant, do you get penalized with alcohol being the factor? There's a stigma there. How do we get past it?
I wouldn't say you get penalized, but everyone who gets a liver transplant gets scrutinized pretty carefully, just because it's such a limited resource, and the goal is to save as many lives as possible. And so people who have diseases that are likely to recur are going to be less likely. And in the case, and again, you also have to be very medically compliant to successfully have a liver transplant and have it result in long-term survival. And so people who, partly for reasons of their own, for reasons that they can't control, who are not going to be able to be compliant with medications, are less likely to receive a transplant. So historically, to get a transplant for alcohol, one had to demonstrate a period of abstinence. And typically 6 months, although that may or may not be any kind of absolute guideline. And there are people who suffer from alcoholic liver disease who don't have 6 months, in all honesty. And more recently, people with very severe acute alcohol-related liver disease, something called alcoholic hepatitis, who are going to die within the month, have been getting rapid liver transplants even without demonstrated abstinence. So I don't think there's any prejudice against people with alcohol-related liver disease because of the nature of their liver disease. But there's a very careful scrutiny of who is likely to have a successful outcome, and that's really where
we want people to be good
happens.
stewards of these precious organs.
We want it to do something useful for the world. If you die 6 months after your liver transplant and somebody else could have lived for 20 years, then that was probably not a wise thing to do.
Okay, what do you both think of Dry January? Or restaurants having more mocktails on the menus, or people having dry weddings, not because of the cost, but just because people are maybe drinking less? Are we making any progress in society?
I don't know.
Be honest. If the answer is no, then we got work to do.
I think that it would really be helpful to normalize not drinking. I mean, there definitely are people who are sort of encouraged to drink more than they would want to from social pressure. Like, you go out with friends to a restaurant or a bar and people order rounds of drinks where whoever is the most alcohol drinking person sets the pace and everyone else has to drink at that pace. And I think that's an extremely unhealthy behavior. And if we could eliminate that, I think that would help people.
Crazy to think how we normalize the drinking, but how to reverse that. That's a big turn to have to reverse it to normalizing not drinking. Remember to ask your questions today. You can use the chat on YouTube or Facebook. You can tweet us or email us at the Medical News Network. The info is right there on your screen. Let's get a quick check of our COVID count with Dr. Dana Hawkinson. Good morning.
Yeah, hi, good morning.
Hi.
It's a nice Monday out for sure.
Yes.
I think the COVID numbers are a little bit better as well from what we have seen. We have 35 total, but 20 active, 6 in the ICU and 2 on the ventilator. So we are still holding on that lower range of our active infections, which is a good thing. And hopefully we can continue that trend in keeping it lower.
All right, Doc Hawk, we're talking about liver today. Hepatitis is inflammation of the liver. And there's this headline in the journal Nature about kids getting severe hepatitis. Last year, hundreds of kids were coming down with hepatitis. Doctors didn't know why. Now there is evidence it might be due to a virus. What can you tell us?
Yeah, so I think we have substances like alcohol, like we talked about, and again, we are always in confrontation and battle with the outside pathogens as well. This was a good study. There's actually 2 studies published in a news article recapping it. This looks at those fulminant pediatric cases of hepatitis, which means very severe cases of children's lung inflammation. And what they found was, originally we had thought it was associated with an adenovirus, which is a very common virus that we probably all have exposure to throughout our lives. But now doing a retrospective study, so going back and looking at all the samples, they found that more than likely, and this is the best working hypothesis that we have now, more than likely the liver inflammation, the illness, was caused by a second virus that needs another virus to help it replicate. In addition, to make it more complicated, they saw that there was possibly a genetic component as well. Vast majority of those children had a allele or a gene that was also associated with autoimmune process as well. So I think it is a combination of multifactorial issue and etiology, but the best evidence we have right now is that what caused that severe liver inflammation was probably a virus which was associated and needed other viruses to help cause the liver damage, but that is also associated with a genetic component for those children as well. It is complex, but this is very good data. I think it is a breakthrough, and it leads us down more paths to help investigate, to try and figure out the full etiology. And they are still looking at, is there an association with COVID-19 or with SARS-CoV-2 infection around that same period of time as well.
Any reporters with us today? Let's get to our community questions. And Angie has one, and one of you might have to be the bearer of bad news. What about that one glass of red wine a day that everyone says was so good for my heart. Is that still okay? Or maybe find something else that's good for your heart?
So this is an area that I think recently there's been a little bit more clarity on.
Okay.
And it has to do with a lot of the reason why people get confused about health studies. A lot of inferences about what's healthy for you have been based on observational studies. Like we just say, gee, let's find some people who drink wine once a day, and gee, they tend to be pretty healthy people. I guess it's healthy to drink wine once a day. But of course, those people are different from others in other ways as well. And there have been very recently published some very, very large studies that try to eliminate all those other effects. And it turns out that you can't observe any beneficial effect of any amount of alcohol. And it's probably people whose habit is to drink 1 glass of red wine a day, no more, no less, are different than average people. In other ways, they may be economically more secure, they may have a different education level, and there are other things that associate with health. So current evidence that has looked more carefully and tried to control for things like socioeconomic status and others cannot find a benefit.
Sorry, Angie. You agree, Dr. Sethi, I would imagine.
Yes.
Yeah, I know. Okay. Okay, so question from Yen Liang. I'm going to read it to you because I do think it's interesting. He says, we all know that drinking alcohol can cause increase in triglycerides and serious health problems. There are 2 statements in our daily lives, he believes. First, alcohol enters the body and is directly converted into triglycerides stored in the body. Second, the energy generated during the breakdown of alcohol in the body, such as NADH, directly accelerates the synthesis of triglycerides. Thank God you 2 are here. Which one of these statements is true? And what is he saying? Because I don't understand any of it. I had to read it directly.
Yeah, I can comment on that.
And what does it mean by that?
Well, there's some truth to both of those statements, and that alcohol is a carbon source, and it is a nutrient, and it's converted to acetate and acetyl-CoA, and acetyl-CoA is one of the building blocks of fatty acids in fatty acid synthesis. So it's true that drinking alcohol provides the substrate that allows the body to build up triglycerides. And it's also true that alcohol essentially is a reducing agent, and it increases this electron transport molecule called NADH.
I told you,
which
I
is
got
also,
a D in biology, Dr.
which
Weinman.
is also involved in fatty acid synthesis, but there's more to alcohol than that. It alters insulin sensitivity, and it alters hormones that regulate fat production, and it alters the intestinal cells that make triglycerides, it alters the liver's ability to dispose of it. So while those 2 explanations have some truth to them, it's really way more complicated than that.
And you don't want us to hang on the word nutrient. Yes, it has a nutrient element, but let's not hang on that by
Yeah, it has
any
lots
means.
of calories, though.
Okay, there you go. And Yen Liang, thank you so much for your very, very good and detailed and insightful question. We always appreciate that. Last question is from Joellen. Dr. Sethi, why are so many people who drink alcohol often smokers as well?
You know, alcohol produces dopamine, and smoking also helps them feel good. So there's an association between drinking a beer and then going out and smoking. And you know, it's just that whole thing about feeling good. And both smoking and alcohol to a lot of people are legal, and a lot of people think it's okay to do it, and then it becomes just an associated pattern of them together.
Let's get today's takeaway. There are a lot of them, but Dr. Sethi, I'll start with you. What do you want today's main takeaway to be for our audience?
I think drink as little as you can, know what a regular drink is, and make sure that if you have to drink as little, don't drink too much. If you think, or if family members and other people are telling you you're having a problem or you're drinking too much, seek help. Talk to your psychiatrist, talk to your medical doctor, talk to your primary care, but seek help. And then if you have developed an addiction, then get into treatment because that's very treatable these days.
Good to know. Dr. Weinman, so good to have you both. Thank you so much for helping me better understand exactly what it's doing. Final thought.
I would just like to say that there's really a threshold when alcohol-related liver disease becomes possible, and that's about 2 drinks a day for women and about 3 or 4 drinks a day for men. Not everyone who drinks more than that will get alcohol-related liver disease because there are genetic factors that make you sensitive. But if you drink at that level, you are taking on the risk that you can damage your liver very severely, and this can be life-threatening. And it can be life-saving if you stop drinking, because at almost every stage of liver disease there's a reversible component, and people who stop drinking heal up and improve, and there's always hope and chance for people.
Thank you both for your insight. Great to see you. Thank you, Dr. Hawkinson. Today's takeaway, what you got?
Yeah, no, I think that's right. You know, I think back in Ireland, they used to almost give Guinness to people that were in the hospital because of the nutrients, and we heard Dr. Weinman talk about that. But I think that's right, you know, and it's unfortunate because we do love our substances like alcohol, like caffeine. They do sometimes help us get us through our daily lives, but it is vitally important to understand, just as Dr. Weinman said, it's probably no benefit when drinking even those small amounts of alcohol. So, and just like Dr. Sethi said, it's important to understand what are your risks, what are you doing every day to affect that risk of continuing to drinking and leading to complications with that. So it's very important to understand that. And of course, as a medical show, we do want to promote the most healthy things, and right now we should be promoting little to no alcohol intake for sure, but just understand that, and if you have questions, please talk to your physicians about that as well and get those questions answered. So
great advice. Thanks to all of our guests and to our viewers and their questions today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, testicular cancer is surprisingly curable, but only when you catch it early. And too many men are not on the lookout. I'm Jessica Lovell on the next Morning Medical Update. The best advice for self-exams and what to watch out for besides a lump, Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.